Hi, how are you? My name is Jasmine. I'll be your interviewer today, so take a seat and lovely to meet you. Thanks for coming along and thank you for applying to our health service for graduate nurse position. So, I'm going to ask you a few questions and you can answer them as best as you can. Try not to be nervous. We are trying to get you to know a bit to make sure you are good fit for us and that you will be successful in a graduate nurse program. So tell me about yourself. What are the some qualities you would bring to our nursing as a graduate nurse?
First of all, a very warm regards. My name is Jasmine Pabla, and it gives me immense pleasure to be sitting here introducing myself. I am in nursing not only because I love to care for people, but also because I love to study my patients. So I'm a very curious person and I want to know why they're there, what kind of drugs they're on, what kind of conditions they've got, so I can give my best when I'm caring for them. As a graduate nurse, I've been looking for opportunities where I could utilize my abilities and qualities to serve people. I feel as a nurse, it's my responsibility to ensure that patients are provided the best possible service. I've been very fortunate to be able to work in aged care for the last 2 years. I've worked under the supervision of registered nurses, care coordinators and managers and provided good care to patients. Apart from my work, I've been on different kinds of placements during my nursing degree. I've been to acute, pediatric, surgical, mental health placements, which I feel have instilled me with a great deal of knowledge. I feel my experiences proved to be a strength, but I especially love my mental health placement. I feel my passion in this field brings out the best in me. I've acquired great skills of organization, I'd say, and time management. I've learned during my placements, which I feel are my strengths. Also, when it comes to patients, I feel it's very important when you're dealing with people, and I feel I have it in me, so it will help me work effortlessly when I'm trying to provide good care to patients at Wanton Hill.
Why do you want to work at our organization? What was made you to apply to our hospital?
As far as I know, Wanton Hill has an aging population, and as I mentioned before, I've worked in aged care for 2 years, so I feel that I will be working in a place I know. I feel my skills that I've acquired during my work will help me to provide good care. Apart from that, Wanton Hill has got mental health as one of its services, which is another area of interest that I have. So I feel I can relate to Wanton Hill as an organization, and my views align to those of the organization as well, which is patient-centered care and implementation of change, so bringing out new things in workplace. Another factor that has enhanced my interest is its location and diverse culture, I'd say. So it's got a bigger population of Indigenous people and non-English speaking people. So I've studied a lot about them, about the Indigenous people. So I feel it'd be lovely to work for them and care for them. Also, as an employee, one major expectation would be that we have a flexible workforce requirements. So Wanton Hill completely fulfills that. It's quite flexible with its workforce, and it aims to expand its care to 120,000 people by 2021 as per my research. So I think it's an ambitious organization, and it would be great to associate with such an organization, and I would be really overwhelmed if I become a part of it. So yeah.
What are your practical nursing interests and why are you interested in those areas?
As an EN, I reflect on my services and I feel I am drawn towards mental health. looked after aged care patients, and there are a lot of mental health conditions in aged care. It can be dementia, a lot of behaviors, Parkinson's, depression, anxiety. It's a great mix of aged care and mental health. I feel I can relate to that field more. Besides, I've very closely experienced a mental health situation with my friend who who was a victim of mental health. So I felt as a nurse it's my responsibility to guide him. I saw the changes that came in him, so I saw him from getting really angry to sad to anxious. So having experienced it in front of my eyes, I can say my skills would help in providing the best care when it comes to such patients, and my contribution would be greater in this field. So yeah.
Have you ever been in a conflict situation? Have you dealt with the situation, and what are some strategies you use to manage conflict?
I think first of all, a conflicting situation can be anywhere in a workplace, but how you deal with it is really important. And having a calm approach to deal with any conflicting situation would help in solving it. I personally haven't experienced any conflicting situation during my placement or my work, but if you're showing mutual respect and you're actively listening what the other person's going to say and you're trying to understand their point of view, I think it would be a more act of maturity to do in such a situation, so you can solve things better instead of arguing, which doesn't seem to give a solution. So I feel it's everyone's responsibility to make the workplace a peaceful and a positive place altogether.
You are working on a general medical ward and you have 5 patients under your care. 4 are in your ward and 1 is being nursed in a private room with infection control measure in place. You have just left that room. Wash your hand and you go in to help a 79-year-old gentleman transfer from bed to chair. He has a history of AMI and he's complaining to you now that he has chest pain, feel short of breath, and actually as you are about to transfer him, he collapsed on the floor. Can you please talk us through your immediate response and your immediate clinic action that will take in the event that this occurred during your shift?
Yes. Well, first of all, in such a situation, it's really important that you stay calm. You do not panic, so you can take the right clinical actions and you can critically think that what's required of you. So in such a situation, I'd follow my doctor's ABCD, which is I'll assess for danger, that if the place is safe for myself, for the patient and for others. Then you check for response. I'll check if the person's responding by doing the sternal rub or by squeezing their shoulders, by calling their name out loudly. If they're not responding, we'll send for help. I'll press the emergency button and I'll get my colleagues to get some help, or call a code blue. Then we go to airway, which is we check if there's any foreign particle in their mouth. We change them to the recovery position, and we tilt their head and hold their chin and get a position that's right for the airway. Then we move on to breathing. We check their breathing, we feel, we listen, we look that if they're breathing or not. If yes, then we monitor and see how they're going. If they're not breathing, then we move on to CPR. We commence CPR with 30 compressions for 2 breaths for a minute, and we continue it till the help arrives. And then finally, when we've got the defibrillator, we hand it over to the seniors. Then we notify the family of the patient, and we let the doctors on duty take hold of the situation, and we monitor how our patient's going on later. So yeah, I feel that would be the appropriate approach in such a situation. So thank you.